Welcome back. In this video, we are going to discuss about a homeopathic remedy called ADONIS vernalis. The common name of ADONIS vernalis is pheasant's eye. Adonis is a very famous heart remedy, usually in Russia. It is a very reputed remedy and it is useful in the cases of endocarditis. So guys, Adonis, it's a kind of a specific remedy. There's no much constitution, mentals mentioned about it. It's more of a heart remedy, heart in which the conditions are like endocarditis. So what is endocarditis? The inflammation of the endocardium, the innermost lining of the heart. Then we also prescribe it in valvulitis. Valvulitis is the inflammation of the valve of the heart. Then we have myocarditis, again the inflammation of the myocardium. Then they're talking about cardiac asthma. So what is cardiac asthma? It is not actual asthma. It is a type of coughing or the wheezing which occurs with the left heart failure, which these symptoms like the cough and the wheezing which is present is mimicking as that of the asthma, but the origin is because of the heart failure. So we term it as cardiac asthma. Moving on, we have cardiac dropsy. So guys, we know dropsy is a word for the swelling because of the accumulation of a fluid. Again, if it is of a cardiac origin, then it is cardiac dropsy. And also the other heart affections after rheumatism. So we know of the rheumatism which causes the damage to the heart valves. After there will be recurrent rheumatic fever episodes, and then it results in the damage to the heart valve. The vegetations will be formed. So it is indicated in rheumatism, the heart affections which are resulting after the rheumatism, or the influenza, or the renal diseases which are landing up in the heart affections. So the main center of action of Adonis is heart. The symptoms what the patient presents with is the rapid and the feeble action of the heart, dropsy as we discussed, irregular and intermittent pulse, edema of the legs, ascites, and also dyspnea. So you can see the pitting edema of the legs here, and also the ascites, abdominal is totally swollen because of the fluid accumulation, and also dyspnea, breathlessness will be there, air hunger, there will be gasping for breath. Heart. So let us discuss in detail about the heart complaints of Adonis. Heart, the mitral and aortic regurgitation. So guys, you can see here, this is the left atrium and the mitral valve present. This is the typical heart, normal heart. So here what's happening, the mitral valve is prolapsing. So what happens, the blood is leaking back into the left atrium. So from the left atrium, it is supposed to enter into the ventricles, right? Normally what happens, from the atrium, the blood passes on to the ventricles and then goes out. So here, what's happening, the mitral valve prolapse happens. As a result, regurgitation of the blood. Regurgitation is what? That is backflow of the blood occurs. So in such conditions, when there is mitral valve regurgitation, aortic regurgitation, so you can see again here the aortic valve which is present and which is failing to close, allowing the leak of the blood backwards. Getting it, guys? Heart, mitral and aortic regurgitation, chronic aortitis. So you can see here, this is an acute aortic regurgitation and this is chronic aortic regurgitation, which is nothing but aortitis. Okay, here this chronic aortic regurgitation will be there. Then we have fatty heart pericarditis. No, the terms are little kind of all medicinal terms. You have to remember fatty heart pericarditis. So what is this pericardial fat? So it's a type of a visceral fat, an organ fat which is found above the organs. This visceral fat will cause the inflammation, and then all such conditions where there is pericardium being inflamed, we have to think of Adonis, fatty heart pericarditis. And then we have rheumatic endocarditis, like we discussed earlier. What happens initially? A streptococcal infection will be there, and then or there can be streptococcal pharyngitis or throat affections. Then these inflammatory reactions, rheumatic fever, then these will result in the damage to the heart valves, causing the episodes of rheumatic fever, and then there will be heart damage and all such things. You can see here rheumatic vegetations which are found in the mitral valve. So we have to think of Adonis in this condition, guys. Have a picture of this in your brain. The vegetations on the mitral valve, mitral and aortic regurgitations, rheumatic endocarditis, and so on. Moving on, the patient will also present with a precordial pain, the pain which is present in front of the chest. There will be palpitations, dyspnea, as we discussed earlier. There is marked venous engorgement. You can see the venous engorgement very beautifully displayed in this picture. There will be venous engorgement again because of the failure. And then cardiac asthma, as we discussed earlier, it presents with wheezing and cough, typically as that of asthma but of a cardiac origin. Then we have fatty heart, that is nothing but this fatty heart, pericarditis. So guys, you can see a cardiac asthma. They are saying cardiac asthma is a situation which is caused by left heart failure. Left heart failure will cause this fluid retention in the lungs, and this will lead to the symptoms such as wheezing, the cough, the shortness of the breath, which is similar as that of the asthma, like I explained you earlier. Myocarditis, irregular cardiac action can be observed, constriction, vertigo, pulse is going to be irregular or rapid pulse, low vitality with a weak heart and the slow heart. The pulse is also going to be very weak here. We also got a few new points. That's vertigo will be there. We studied about the pulse. Vitality is low. The pulse is going to be weak. The heart is also going to be weak. Moving on to, so we have come to an end of the heart symptoms, guys. I hope you have enough of symptoms to mention. Let us just have a rapid look at the slides. We saw the introduction, and then the symptoms what the patient presents: edema, ascites, and then the pulse, regurgitations, the fatty heart, rheumatic affections, engorgement of veins, cardiac asthma, and then the heart is going to be weak, pulse is weak, vertigo, and so on. Now let us move on to head. In head, the patient feels light, and then the aching is found across from the front. From the occiput, it goes to the temples, and from the temples to the eyes. So you see, guys, it is aching across the front, and then the pain is traveling from her occiput. It goes to her temples and then lands in her eyes. So we have a radiating pain from occiput to temples to eye. Okay, we saw this point. Next we saw about vertigo. So when does this vertigo occur? When the patient is rising from the bed, or turning the head quickly, or when he is lying down. So both the conditions: vertigo when the patient is lying down, vertigo when the patient is rising, or when he is turning the head. Tinnitus, that is the ringing or buzzing sound which we hear in the ears. The scalp feels kind of light, tight. Okay, scalp feels tight, head feels light. Eyes are dilated. So let us see the mouth complaints. In the mouth we have a slimy tongue. The tongue is going to be coated dirty yellow. It is very sore. It feels as if it is scalded. You can see the tongue very gross and dirty yellow color. Stomach. Stomach, there is a sensation of a heavy weight on stomach. So guys, you see here at Adonis, we have both the chest as well as stomach heavy weight. You'll see in the further slide in the respiratory, the person feels as if a heavy weight is kept on his chest. Similarly, even in the stomach, they feel as if a very heavy weight is kept on their stomach. They have a gnawing hunger. So what do you mean by gnawing here? Gnawing hunger is something which is, concerning the person so much. All the time the person is hungry. It is causing him a lot of worry. Faint feeling is felt in the epigastrium. It is better out of doors. So when the person goes out, the complaint is ameliorated. The faint feeling what is having in the epigastrium. Moving on to the urinary complaints, there is oily pellicle on urine. So what is this oily pellicle, guys? Oily pellicle is nothing but when you see this oily droplets in the urine, kind of oil droplets which is seen in the urine, the scanty urine and albuminous urine. So you can see here a clear picture of urine, and this is the albuminous urine. Albumin is found in the urine. Okay, so moving on to the respiratory, we have a feeling of weight on chest like we saw earlier, and then the patient feels he has to take deep long breaths. The sense of suffocation, breathlessness, dyspnea, air hunger. So what happens? There is cardiac asthma. So guys, you need to relate the symptoms. Think of Adonis, heart affections. Then write about the dropsy, what the patient has, ascites. Then cardiac asthma, which is mimicking endocarditis. And then when all these symptoms are there, there is breathlessness, dyspnea, sensation of weight in the chest, pain in the epigastrium, and all that. Okay, urine, albumin in the urine. Sleep. Sleep, we have restlessness with the horrible dreams. You can see the patient is going to have very horrible dreams and is going to be very restless in his sleep. Extremities, we have aching in the nape of the neck. The spine is very stiff and aching. So like there are some conditions where you have this stiffness, the aching pain, and also because of the stiffness and pain and everything, there can also be edema, the fluid which is accumulated here. You see a kind of a bump here. It is going to be like this, swelling all over, and then pain is there in the nape of the neck. So it's a very short remedy. With this we come to an end of Adonis. I hope everything is clear. If you have any doubts, put it in the comment section, and if you like my video, hit the like button and subscribe.